Hi, my name is Caitlin Bailey. This is my client Brian. He is 31 years old. And before we began, he filled out the physical activity readiness questionnaire, and he did not have any concerning health history or risk factors. So we're ready to begin the functional movement assessment. So Brian, today we're doing the functional movement screening tests. These are to assess your movement patterns and see any imbalances or weaknesses in the body. So the first assessment we're going to do is the deep squat. To start, I'm going to have your feet shoulder width apart, your heels all the way pressed back up against the board. To find your hand placement on the dowel, you're going to have your hands overhead and find your elbows bent at 90 degrees. Good. Once you're there, you're going to press your hands overhead till your elbows are fully extended. And to begin the assessment, you're just going to lower yourself down, bringing your hips back, trying to get your thighs lower than your knees. Good, and then stand up. Nice, so I saw there that his thighs got below parallel, so parallel to the floor, they were below that point. He had good stability in his trunk. Let's try that assessment 2 more times. Nice, he had great alignment with his knees, feet, and hips. We're going to have the last assessment done from a lateral view. So if you could just step forward, Brian, I'm going to turn this around. So set yourself up again with your heels against the board, feet shoulder distance apart, arms pressed overhead, and let's take that same assessment again. Good, hold for a second. I can see that his spine is parallel to his tibia, which is what we're looking for, and he had no movement in the lumbar spine or the thoracic spine. Great job, Brian. Come on out. I would score that a 3. For our next screen, we're going to be doing the hurdle step assessment. We're going to test his right side first using the anterior view, and then when we test his left side, we'll go to the lateral view. So for this test, Brian, we need your feet together, toes up against the base of the hurdle. Before we began, we measured Brian's tibial length by measuring from the floor to his tibial tuberosity, and we got 18 inches. So the height of the hurdle is set at 18 inches. So for this assessment, you're going to have your hands grip comfortably on the dowel, with them resting across your shoulders. Good. Maintaining good posture and the dowel parallel to the hurdle, you're going to try to step with the right foot, clearing the hurdle, extending the knee over top, touching the foot down on the floor in front of the hurdle, and then return to the starting position. You'll get 3 attempts on the right side. Go ahead. Good, and return. So I did notice some imbalances, some compensatory movements on the way back over the hurdle. The dowel did not remain parallel with the top of the hurdle, so we're going to give him 2 more tries. Good, a little improvement on that try, but we're going to give him 1 more. Saw some wavering balance. Good, so for the right side, I'm going to score Brian at a 2. He was able to do it all 3 tries, but he did have some compensatory movement in the torso and a little bit of balance issues on the way back over the hurdle. We're now going to test Brian's balance and stability on his left side. We're looking for the ankle, knee, and hip to remain in the sagittal plane, and we'll see how he does with the left side. Go ahead, Brian. Good, end up with your feet together. Give him 2 more tries. Good, a lot better balance on this side, and the dowel is able to remain parallel to the hurdle. Let's try 1 more time. Excellent. So I would give Brian a score of 3 on the left side. He didn't have any rotation. His foot, knee, and hip remained in the sagittal plane throughout the entire test, and the dowel was parallel to the hurdle. Great job, Brian. In the inline lunge assessment, we're going to test Brian's hip, ankle mobility and stability, his knee stability, and his quadricep flexibility. So before we begin, we're going to have his foot placement set up using that same measurement of his tibia by measuring from the floor to his tibial tuberosity, which was 18 inches. So we're going to have the heel of the front foot on the board. And the distance between the heel of the front foot and the toes of his back foot will be that 18 inches. Your toes here. Good. So we're testing the right side of his body first with his right foot forward. Now you're going to place the dowel behind your body with the contralateral arm on top. That's going to be the left arm, cervical spine, and the right arm on the lumbar spine. So trying to keep the dowel in contact with the back of your head, your thoracic spine, and your sacrum. You're going to lower down so that your back knee lands up on the board right behind your front heel, trying to maintain good posture, balance, and stability. Nice. Now that was a good screen. Brian was able to remain the dowel in line with his back of his head, his thoracic spine, and his sacrum. He was able to touch his knee to the board behind his front heel. Let's give him 2 more tries. Excellent. So we can stop right there. I would score the right side of this inline lunge with a 3. Okay, we're now going to test the left side on the inline lunge assessment. We'll have Brian's left foot forward, his right foot back. The distance between the front heel and the back toes will be that 18 inches again. So you place the dowel behind your back with the contralateral arm on top, making sure that it's in touch with the back of his head, his thoracic spine, and his sacrum. Go ahead, you can begin the assessment. Good, so I did notice this time that we had some compensatory movement in his thoracic spine. The dowel did not remain in contact. We'll give him 2 more tries. Good, and let's give him 1 more try. Good, so Brian has excellent balance and it looks like good ankle, knee, and hip mobility. However, I did still see that disconnection from the dowel and the thoracic spine, so I'm going to give him a 2 on the left side. Next is the shoulder mobility assessment. So before we began, we determined Brian's hand length by measuring from his wrist to the end of his 3rd digit. We got 8 inches, so we'll be using that as a guide for this assessment. So if you could turn around, Brian. So this is going to test his shoulder range of motion. So I'm going to have your both your hands in fists with your thumbs inside your fingers. I'm going to place your right hand on the top of your spine, cervical spine, and then your left hand underneath as close as you can to the top hand. Good. So we're going to measure between his hands. Excellent. So he's about at 7 inches, so that's within a hand's length apart. He's less than 8 inches away, so we're going to score him a 3, barring the clearing test. If you could turn back around, Brian. The shoulder clearing test is just to screen for any pain. If Brian has any pain with this, he'll get a 0 on the test. So for this one, we tested the right, so we'll do the shoulder clearing test on the right. If you can bring your right hand to touch your left shoulder, and then try to lift your elbow as high as you can. Any pain with that, Brian? No pain on the shoulder clearing test, so he'll receive a 3 for the right. So now we're going to test the left. So if you could turn back around. This time the left hand will be on top, touching your cervical or thoracic spine, and your right hand underneath, and we'll measure. So the range of motion is a little bit less on this. We got 11 inches, so that would be using the benchmark of a hand and a half, or 12 inches in Brian's case. So he is within that limit, so he'll receive a 2 on this, but we'll give him 2 more tries. Go ahead. Good, relax. We'll give him 1 more try. Good, so after the 3rd try, he's still at 11 inches, but that's within the 1.5 hand length away, so he'll receive a 2, barring the clearing test. So for the clearing test, we could take your left hand to your right shoulder and lift your elbow. Any pain with that?
No.
Good, so his assessment, his score will be a 2 for the left. In the active straight leg raise assessment, we're going to test Brian's hamstring flexibility. So I'm going to use the dowel as a reference point and place it between his anterior superior iliac spine and the mid-patella joint point. So we're going to start with the right leg first. Both feet are going to be dorsiflexed, that means pulling your toes back towards your shin. We're going to try to keep the opposite leg, or the left leg, with the back of the knee in contact with the board. You're going to have 3 attempts to raise your leg straight up, your right leg straight up, and we'll see how high it goes in reference point to the dowel. Go ahead. Good, and lower. Good, so I noticed that his left knee was able to remain in contact with the board. I did notice that his right knee bent a little bit. However, he did get his malleolus past the dowel. We'll give him 2 more tries. Excellent. So I noticed that time Brian was able to keep his leg straight and his ankle was able to go past the reference point of the dowel. So he'll get a 3 on the right side. We're going to now test the left side. So same thing, dorsiflex both feet. Try to keep the right knee in contact with the board as you lift the left leg straight. Good, so on that attempt I noticed that his right knee came off the board, so he had a little compensatory movement on the right side. We'll give Brian 2 more tries. Good, let's give him 1 more try. Good, so I did notice a little bit less flexibility on his left side. However, he was able to keep the leg straight, and on his last 2 tries, his right knee was in contact with the board and his ankle past the dowel. So he'll receive a 3 on both sides. Next, we're going to do the trunk stability push-up assessment. So in this, we're assessing Brian's ability to stabilize his spine while his upper extremity is performing a movement. So he's going to be laying in the prone position with his feet together and dorsiflexed. His hands are going to be placed on the floor, shoulder width apart, with his thumbs in line with his forehead. So when you're ready, Brian, you're going to perform a push-up off the floor, trying to keep your shoulders in line with your hips, and to lift your body as 1 unit off the ground. Go ahead, Brian. Good, so I saw that his chest and hips lifted off the floor at the same time. He moved as 1 unit, and I didn't see any compensatory movement, so Brian receives a 3. I'm now going to perform the spinal extension clearing test. So I'm just going to have Brian keep his hips on the ground, extend his elbows, and lift his chest up off the floor. Any pain with that, Brian?
No.
So his score remains at a 3. In the rotary stability assessment, we're going to test Brian's neuromuscular coordination and his ability to keep the trunk stable during multiplane movement. So he's going to start in the quadruped tabletop position with his shoulders over his wrists, his hips over his knees, and his head and neck in line with the rest of his spine. So to start, you're going to do a unilateral movement by trying to lift the right arm and the right leg about 6 inches off the ground. Good. So we have a loss of balance there. That's okay. It's a very hard movement. So as an adaptation, we're going to have, still testing the right side, have Brian lift his right arm and his left leg using a diagonal. Good. And replace. Good. So I noticed he was able to keep his spine straight. Had a little bit of waver and balance on the way back down. We'll give Brian 1 more try. Good. So he was able to do it with a diagonal movement pattern, and Brian receives a 2 on the right. We're now going to test Brian's left side in that same position. So Brian, if you could start unilaterally by moving your left arm and your left leg. So we have that waver and balance again. We're going to give him another try utilizing the left arm and the right leg for a diagonal adaptation. Good, we'll give him 1 more try. Good, so I saw a good trunk stability from Brian, and barring the spinal flexion clearing test, he'll receive a 2 for that side. So for the clearing test, if you could just send your glutes back to your heels, Brian. Any pain with that?
No.
So Brian will receive a 2 for this test.